two group partners, and we chose aerobic exercise for our project.
So aerobic exercise training can also be referred to as cardiopulmonary endurance training. Aerobic exercise is defined as augmentation of the energy utilization of the muscle by means of an exercise program. Aerobic training strengthens the heart and lungs and improves muscle function. Aerobic exercise are a form of activity that raises your heart rate and makes you breathe harder. All right, so as we just mentioned what aerobic training is, we're going to talk about the benefits of it now. So the benefits of aerobic training is it can improve your cardiovascular conditioning, it can decrease the risk of heart disease as well as decrease the risk of getting diabetes, lowers your blood pressure, increases your HDLs, your high density lipoproteins, or your good cholesterol, can decrease your LDLs, your low density lipoproteins, helps to control blood sugar, assists in weight management and weight loss. It improves lung function and decreases your resting heart rate, which will help increase your exercise heart rate there. So some specific populations that would benefit, really and truly everybody, okay? More so of clinical settings, you can see patients that need cardiovascular improvements, active patients trying to return to their normal gait or normal function, anyone who is at risk for heart disease, patients with high blood pressure, and obese patients. So a lot of cardiovascular machines that you're going to see in the clinical setting are going to be a new step, which we're going to show you all these upstairs. Recumbent bike, treadmills, upper ergometers, lower ergometers, some rowing machines, and another big one is aquatic therapy. All right, so we're going to discuss our case study now. Derek is an 18-year-old male basketball player who tore his left lateral meniscus 6 weeks ago. He has progressed to the return to function phase, and he's eager to start his senior season. So what we will do is a circuit-style aerobic training program during this phase. So to determine his heart rate for the aerobic training, we're using the Carbonin method. So the way to do that is we're trying to get our exercise heart rate. So to find my heart rate max, I'm going to do 220 minus my age, which gives me that. So the method is right here. So what we did, he's got his heart rate rest is 68 beats per minute. We're using 70% of his heart rate max. So that's going to give us 134 beats per minute. Then we add that plus the intensity. So 68 plus 93 is going to give us 162 beats per minute, which is going to be his exercise heart rate.
Okay, so for a part of his warm-up exercise, we're going to get him to walk on the treadmill, and our goal right here is to get his exercise heart rate within 20 beats of it. And after a little while walking, we're going to get him jogging to get up to that heart rate. You're probably going to do the intensity the speed about 4.5. Okay, so in the early stages of rehab, we're going to get patients, more like elderly patients or low-level patients, on a bike like this, and it's not necessarily going to get their heart rate up, it's just going to get them warming up their body. Okay, this is a new step. It's also something we can use for low-level patients early in the rehab process. All you do is just go forward and backwards. It doesn't have a circular motion with it. Okay, so another piece of equipment that Dustin mentioned earlier was the ergometer. And for this, you can do the upper body in case you have an immobilized lower extremity. You could also do lower body on this, or you could do both.
This is our patient Dustin, so we're going to begin him on his circuit training. We're going to start off with lateral shuffles with the band to the 3-point line while he's dribbling just for 1 minute. Then we're going to do lateral shuffles to each cone, followed up by a jump shot. I'm just going to get him to go down and back 2 times. And we're going to do Bosu ball for free throws. I'm just going to get him to do 10 free throws and do 3 sets of that. And then we're going to do burpee jump shots. So I'm going to get him to do a burpee, and every time he jumps up at the end of the burpee, I want him to do a jump shot. We're going to do 8 of those for 3 sets. Then for the cool down, we're going to do some static stretching and foam rolling. Okay, so with Dustin, for these, we're going to do the lateral shuffles with the band. We're going to get him to start at this cone down here and go down to that 3-point line at the other cone. Then I want him to dribble while he's shuffling. when he gets to each cone, I'm going to get him to do a jump shot. So for this one, I'm just going to get him to go around and then back to where he started and do that 2 times. Burpees. So he's just going to jump up, go down onto his hands and his feet and do a little bit of a push up, and then when he comes back up to jump again, I'm going to throw him the ball and he's going to shoot a jump shot. Standing on a BOSU ball and shooting free throws from the free throw line. We're just going to get him to do 10 of those for 3 sets. Doing it on one leg, that affected leg, to work on that balance a little bit more, okay?